Hey friends, if you're dealing with pain in the front of the knee, I have a great video for you today. I'm going to show you the best exercise plan to reduce your knee pain and improve your function. Here we go. Welcome back, friends. Dr. Josa here to help you move better and feel better. Thanks for tuning into the show today. Pain in the front of the knee, also known as anterior knee pain, patellofemoral pain, or runner's knee, is characterized by that pain behind or around the kneecap or patellar region. Some of the common activities that are painful include prolonged sitting, stairs, and squatting. Exercises targeting the hip and knee muscles, progressing from non-weight bearing to weight bearing, are highly effective for treating anterior knee pain. Today, guys, we're going to start with exercise in the non-weight bearing position to really strengthen up the hip and knee muscles in a less stressful position for your knee. All right, guys, the first exercise we're going to perform is to activate and engage your thigh or quadricep muscle. So in this position here, we're going to tighten your thigh or quadricep muscle, pushing down to the table or floor. You're going to tighten that muscle, hold for 5 seconds, and then relax. So tighten, push that knee down straight, locking that knee out, and relax. So tightening and engaging that muscle is going to strengthen and stabilize the quadricep muscle and stabilize your knee. 5-second holds, perform 15 reps. All right, guys, for this next exercise, it's going to be a progression from our first exercise. We're going to perform leg lifts on your back. So with this exercise, we're still going to perform our tightening of our thigh or quadricep muscle. Maintain that tightening, and then you're going to lift your leg up off the table or floor about the level of this opposite knee. Slow and controlled up, slow and controlled down, and then relax. So controlling that knee up and down, strengthening that thigh to stabilize that knee and kneecap or patella. Performing 10 reps, up to 2 to 3 sets. The next 2 exercises are going to focus on the hips. The hip muscles have a huge role in controlling and stabilizing the knee. This is going to be a big part of improving your knee pain. The first exercise we're going to perform for our hips is to perform leg lifts on your side to strengthen the outside of your hip and stabilize that knee better. So lying on your side with your bottom leg bent, top leg is going to be straight. You're going to keep your hip tilted forward slightly. You're going to raise that top leg up towards the ceiling, controlled up and controlled down. So with this exercise, you should feel it on the outside of your hip, or you should feel that muscle burn and fatigue to know you're doing the exercise correctly. Perform 10 reps, up to 2 to 3 sets. For our next hip exercise, we're also going to perform that lying on your side to engage the rotators of the hip to better stabilize the knee. We're going to perform clamshells. So lying on your side, you're going to have both knees bent up, keeping your feet together, hip slightly forward again. You're going to slowly raise that top knee up towards the ceiling, pause at the top, and then control back down. Keeping that hip forward, raise that top knee up towards the ceiling, control down, and relax. With this one, you're going to feel that muscle burn and fatigue on the outside and back of the hip, activating those rotators of the hip to better control that knee. This clamshell exercise is a good exercise to add a resistance band to. So if you have a loop resistance band, you can use this to further strengthen those hip rotator muscles. So with the band above your knees, you're going to perform the same clamshell exercise, raising that top knee up towards the ceiling against that resistance, keeping that hip forward. Perform 10 reps, up to 2 to 3 sets. Now that we established some good strength in the non-weight bearing position, we can move to the weight bearing position to further enhance that knee strength and function. Squats are a good way to strengthen and work on control in the knee. Focus on hinging at the hips, pushing your hips back like you're sitting in a chair. Shoulder width apart with your feet. You're going to work on pushing those hips back, keeping your head and chest up. Hinge at those hips. Get your hips back to the chair. Feel for the chair on your bottom. And then stand back up. So if you have a loop band, you can use the loop band around your knees, right above your knees, to further enhance hip engagement with the squat. So with that loop band, keep those knees apart as you go into your squat. Focus on getting those hips back, engaging those hips, reaching for the chair, come back up. Performing 10 reps, up to 2 to 3 sets. Another great exercise to perform in the weight bearing position for anterior knee pain is to perform band walks. So if you have a loop band, this is a great exercise to further strengthen the hip and the knee musculature. So for this one, we can have the band just right above the ankles. We're going to keep our feet shoulder width apart. Knees slightly bent, so a quarter squat position with our hips back. We're going to pull out laterally with that lead foot and then step with the opposite foot. Feet shoulder width apart, step and step. Picking up the feet with every step, controlled fashion. So depending on how much distance you have, you can go 5 feet up to 15 to 20 feet, 2 to 3 times until you feel that burn on the outside of your hip, strengthening those hip muscles to better stabilize your knee. Thanks for watching today, guys. Perform these exercises to help with your anterior knee pain. If you found today's video helpful, click that like button and subscribe for more videos. I'm Dr. Josa, helping you to move better and feel better.